Hello everyone, I am Dr. Minal Chandra. I am a consultant pain physician at EPON Center for Pain Relief and Beyond, Hyderabad. EPON Center for Pain Relief is a center which deals with all types of chronic pain in a multidisciplinary approach. For today's video, I will be talking about back pain. So the back pain is very common, and majority of the population will once in their life will go through this episode of back pain. And when your back pain becomes more than of 3 months, then it is called as chronic back pain. And almost 40% of the population in India suffers with chronic back pain. Usually what happens is when we start with back pain, we think it is because of the muscle or because of our body structure or because of our work and different kinds of posture. But eventually when the pain does not subside, we do need to seek help from your physician, from your pain physician, who can properly diagnose the cause of your pain, who can diagnose, examine, and then come to a conclusion what is the cause of back pain in you and treat it accordingly. The reason why I am telling you this is because if we leave the back pain thinking it's mechanical back pain, thinking because if it's your household cause or because of your bad posture, it may lead into a situation where the pain may become so severe that it would really be very difficult to treat. So today I'll in general be talking about what are the causes of back pain. If we go into the literature, there are numerous causes of back pain, but I'll just list out the few very important causes of back pain which we should be aware of, and so that we can explain this to our consulting doctor and he can make a diagnosis from it. So this is the spine, and this is the backbone. I'm mainly concentrating on the low back, which is the lumbar area. So there are lots of structures in it. This is the spine bone. The spine bone has lots of different various body parts. So one of the very common cause of back pain could be a disc prolapse. So discs are these soft cushion-like structures which are present between the two bones, which help you in the movement of the spine. So what happens is because of any injury, or in old age because of degeneration, or because of obesity, or because of your bad posture, the disc has a tendency to come out. When this disc comes out, it starts compressing the nerve root here, and then your pain may start in the back and then may radiate all along the legs. It may be either on one leg or on the both legs. Very commonly we use the term sciatica for it. So the classical feature of sciatica would be a back pain which starts in the back pain, which goes all along your leg. Depending upon at what level the nerve compression has happened, the pain may radiate. It may radiate up to your thigh, or may reach up to your calf, or to the ankle, or even to the foot and to the fingers. Sometimes the disc may not come out, but there may be a tear, a small tear in the disc, which is called as disc tear or annular tear, which you can see it in your MRI. And your physician can identify it and can treat it accordingly. Another very common causes are the small joints which connect the two vertebral bones on the either side. These are called as facet joints, and any degeneration of the joint or any trauma to the joint can be a cause of low back pain, and this pain is mostly when you try to hyperextend your back. In young females who have just delivered, usually in post-delivery patients, this joint, which is called as sacroiliac joint, which is formed between the sacrum and your hip bone, becomes a potential source of pain. And this pain usually will be here around the hip area, and getting up from the sitting position will be very difficult. Usually it is seen in postpartum females, and this kind of pain usually is misdiagnosed or being taken as because of the epidural injections taken during the pregnancy or spinal injections taken during the pregnancy. But no, this kind of pain is because of the degeneration or because of the inflammation in your sacroiliac joint. The sacroiliac joint becomes very stubborn with time if not treated properly, if not treated in a multidisciplinary way. Then again, there are lots of other causes. There are lots of muscles which cover above these spines, and different muscles may be a potential source of your back pain. Then take care.